not very often that we get to bring this up with someone that's educated in this, because most times people hear CBD, they think illegal weed or marijuana.
There's a big stigma around it, and I spent probably
stigma. There's a word. We know about stigma on a lot of stuff in here.
And exactly, with anxiety, mental health, there's such a stigma with everything that it's really just educating people and bringing awareness to the product itself. That don't be embarrassed to tell people that you're taking CBD. It's a very holistic approach to relieving anxiety, relieving stress. It's something that I take daily.
Is it legal?
So in 2014, CBD from hemp became legal in the state of Florida. As well as many other people in the state of Florida, that medical marijuana has now become legal as well. But just this year, it was passed on the Farm Bill that CBD from hemp is now federally legal. It doesn't mean that, it's just go out and do whatever you want with it. There is some guidelines and gray areas to it, and there's still guidelines being developed even now. So I think that we're going to continue to see changes throughout the next, 2, 3, 5 years.
Right. So it's not illegal just to buy it or to go order a cocktail or something like that?
It's not. So there are some, we're starting to see...
Am I sitting in a room full of illegal products
you
right
are
now?
not.
Just making sure.
No, I would be covering my face right now if that was the case. But we work with a lot of, like I said,
I don't know this lady. No, I'm just kidding.
We work with a lot of health professionals, and we've seen a lot of benefits in overall health and wellness with medical clinics where they're treating patients that have pain disorders, autoimmune disorders, migraine disorders, sleep disorders, and we're able to see the benefits of what's happening with these patients, which for us is pretty rewarding because we've been so hands-on with the development of these products. My husband and I use these products, so to get feedback like that from our physicians and from our patients, it's pretty rewarding to know that we've developed something that's actually helping people. Mm-hmm. So a little bit about some of our products. We do both capsules and oils. The difference in the capsules and oils is just...
So she has the capsules, CBD capsules, and then dropper oils. Like I said, it's coming in like a bottle.
Everyone loves the oil.
Extract and the capsules. What is the difference?
So they're basically the same thing. It's just a different avenue of taking it. And obviously taking it in capsule form, it's going to take a little longer to get into your system. The oils are stronger. They're double the dosage of the capsules. They're both 30-day supplies. And they're just a quicker way of actually receiving benefits of CBD. And then we have our sleep disorder syrup. It has 1,000 milligrams CBD in it, mixed with melatonin and some other relaxation blends in it that will help with muscle relaxation and things like that. Most of them are natural blends. So
what do? You take this and then shake well before each use. Take 1 to 2 teaspoons and 15 to 30 minutes prior to desired sleep relaxation time. So I'm sure that there's a lot of people that have trouble getting to sleep.
Yeah. So this is really and truly for those patients that have a hard time getting that deep REM sleep, that they just can't stay asleep. This is really something that helps them. For me, most of the time, I can just take the oil and I'm good. But when it comes to...
There's a lot of people that can't get to sleep from past trauma or anxiety, or they stay up watching TV, things like that.
Yes.
I recommend always, turning off electronics, trying to take a hot shower before bed, melatonin, but there's not a lot of healthy things because not a lot of people want to take Ambien or trazodone or sleep medication.
One thing I'll say, though,
especially with alcohol or any of that.
If you're going to take the sleep syrup, just go to sleep. Don't try to operate anything, go to bed.
Don't try to
It's
cook.
just for bed, The oil, on the other hand, is something you can take throughout the day. You can function on it. You can drive on it. You can go to work. So that's a little bit different. So, and then of course,
does it make you groggy the next day?
The sleep syrup can. I've definitely taken it, and it's made me feel a little groggy. If you've ever taken melatonin, the same effects pretty much. If you're somebody who gets groggy off of that, it can be the same effects of it. So I have a extra strong coffee to get myself going that morning. But I will also have had a pretty good night's sleep. So it just takes a little bit to get going.
Maybe take it a little earlier in the evening, or something like that.
Yeah, absolutely.
And Yeah, so I mean, it sounds like all these things are helpful things, like pain cream without taking a pain medication. It's a topical cream. You want to talk a little bit about this?
Yes.
So let's say I know somebody that gets knee pain. Well, I was in a car accident. You told me to put it on my lower back, and it did help. It felt kind of icy hot, but I mean, especially with the colder weather.
Yeah.
And the rain and everything, it does affect the joints. And if you guys are like me, where there's been some sort of car accident, anything like that, I mean, it's not anything that
I actually put it on this morning because I slept wrong, believe it or not, and my neck just hurt. So I put it on just this morning. But
like you woke up with a kink in your neck?
Yeah. And I put it on just so I'm like, okay, I just get myself going. But it works fairly quickly. But it's one of those things that it is a topical. It's not going to pass through the bilayer of the skin. So if you really have something
go in your bloodstream or anything like that.
If you have something internally, you really want to take the oil or the capsules so that you have it going internally. This is something that's just it's going to be completely external. So it's going to relieve the pain and block those pain receptors, and it's going to reduce inflammation. But it's not going to actually pass through the bilayer.
What about people that are in recovery, where they're not supposed to use any?
Recovery is great. There was actually a case study done on patients who had detoxed for a solid 2 weeks to get things out of their system. They're not able to take anything, and this actually, when CBD gets into your system, in this case study, it showed within, I believe it was 48 hours of CBD being in their system, it blocked the craving that they had to take that opioid again.
Oh, really?
Yes. So it's something that can be used quite a bit in rehab clinics.
For cessation or to be a preventative or something.
So we actually were just picked up in a case study. Our particular brand was picked up in a case study on pain management, and then also they're also working with some rehab clinics in a case study as well. So that just kind of tells you the effects of our brand in general, how we test the quality of it. We want to make sure that where it's coming from, we always make sure that the brand stays consistent with the quality of what we're doing.
That would work for like smoking cigarettes and stuff. There's like Wellbutrin, and what's the one with the C that you see commercials for? Cialis, or I'm going to get it mixed up with
you're going to say the other word?
Yeah, the ED one or something.
Yeah.
One where
I don't know if we want to block that.
No, it doesn't block that, right?
No.
It has no effect on the
should not. But if we're going to talk about some side effects, if we are going to talk about side effects, we will talk about the fact that it could be an appetite suppressant for some people.
And it also can cause
people. Yeah. Can also cause bowel movements in some people.
It helps get people regular too.
Yeah. So, but on the other hand, where it could cause you to use the restroom, it could also, we've had people with IBS that said it stopped it completely for them. So it just really depends on the person.
So not everyone. With the gastrointestinal, the GI.
Exactly.
That's that. I mean, those are benefits. I mean, those are proven case studies.
Yes.
Did we have a caller? Well, we are welcoming callers, 866-826-1340. And there's a lot of great things. We have some comments on Facebook, and I think the video footage is but we still have people listening. We have Sean Martin said he's a big supporter of CBD treatment. He says most people are unaware that every living thing has an endocannabinoid.
Yes.
I'm saying that right?
We have
system that affects digestion, sleep, mood, and cognition. And CBD helps with these things, and he's found, and also the VA is finding that CBD treats PTSD symptoms directly with no side effects. And I think he continued to say something. Do you plan to, assuming, bring it into the VA or to work with veterans with that?
We would love to.
Thank you, Sean, for posting on Facebook.
Yes, thank you, Sean. I mean, it's something that if there's an opportunity for us to get into something like that with the VA, we would absolutely be open to it.
Wouldn't that be amazing if it does help PTSD with veterans?
Yes.
I mean, the sleep is one of some of my patients that are veterans. The sleep is the hardest part with post-traumatic stress. It's getting past flashbacks, sleep, and anxiety and things. And a lot of them have turned to medical marijuana in order to be able to actually rest or, ease their mind and get,
well, we would definitely love to be a part of anything like that.
That would be amazing.
When it comes to, but as you know, as probably many people know, when it comes to the VA government, it's a lot more difficult than what it sounds to just come in and say, hey, we want to be part of this.
VA, but with private practice. So let's say it's approved and I'm a licensed therapist, and I'm a TRICARE provider, so I have a lot of veterans and police officers in Pinellas County, first responders.
So that's what we
So
do. We go
imagine if
we go
that
out
could
to clinics now. We work one-on-one with privately owned clinics. So if there's ever an opportunity to work with any of the clinics that are working with vets, we are happy to go into them. One thing
I think we were going to do that with Safety Harbor Counseling Center,
absolutely,
and see if we can and market these things. And as long as it is legal, it's not marijuana. We're not promoting, but I mean anything that is something healthy, holistic, and for the greater good. But not only that, but to help alleviate. There's a lot of people that suffer with post-traumatic stress and trauma that don't want to take medication.
No.
And if it's a holistic way to do that, and it can help them sleep and help them alleviate flashbacks and trauma and anxiety and irritability and outburst, and so many things come with PTSD a lot.
Yes.
And partially, but mostly, trouble sleeping.
Yeah. Well, we have a large base of an older population as far as our customers that, they take so many pills already that they love our oil because it's something that they can just take. It's not another pill they have to swallow. And it allows them to maybe reduce some of the other medications that they're having to take, especially pain management.
Yeah, because I think that there's a big thing that's going on with the narcotics. Like, they're trying to get them off the market altogether.
I worked in medical pain clinics for 6 years, and I saw the outcomes of people taking opioids, and which is again another reason why I'm so passionate about CBD and what it can do for that industry. As long as physicians see the opportunity there and they're educated enough to pass that along to their patients, I think they're doing a greater good.
Yeah, and if it's healthier for the body. Okay, so my father died from cancer as well, and
Sorry.
Well, thank you. And but he was also a veteran, and he died from Agent Orange, and years after the war. And same with my uncle, and I saw them go through a lot of pain.
Yeah.
And sometimes the narcotics made them more sick, especially going through chemotherapy and all this.
Well,
and then they even push marijuana on them. They're like, you need to eat, you need to be able to stop the nausea, all this. And if this is legal and not harmful to the body, imagine all the other benefits that could come from it.
CBD there was a case study done where it actually does help with neuropathy and nausea after chemotherapy for a lot of cancer patients. The only thing is that it didn't help with was the appetite, and my father faced the same thing. He needed to eat. He didn't have an appetite a lot of times, but he did not like the psychoactive of marijuana.
Or anything.
He just
I remember,
didn't like it.
I remember my uncle even said that. He's like, I think I need to get some weed. I'm like, I don't even know where to get it. I was like, I've been out of the, back in college maybe, but no, I don't even know what to do. And then, but want to help him out and stuff. And I remember even just asking clients where would you go, just because I don't know, the whole smoking part, and plus if someone's anti-drug and they are just against it, but they are desperate to feel better, I mean, that's when it's kind of well, we're gonna have to do what we gotta do because I need to feel better,
Yeah.
And so it's I don't know, it's having a helpful alternative where it doesn't make someone paranoid, it doesn't make someone feel out of control, it doesn't give
that
somebody,
was my problem in college.
it doesn't give someone munchies or something, you know what I mean, to be able to relax and take the effects that a lot of people use marijuana for without those kind of possibilities. I know in the legal states like California, for example, they have it down to a science with indica and sativa, and where it's this one will cause this, or this one will do this, or this is for chemotherapy, or this one's for or whatever. And I hear a lot about that too. We have a caller, Sean. Hey, Sean, thank you for calling into Moments of Clarity.
Hey, thanks for having me. Yeah.
Hey, so I know him. He's Sean Martin.
Hi, Sean.
And one of the admins with Moments of Clarity, but is also a veteran with Army Airborne Infantry. And Sean, did you have a question or some feedback? Because I know you know a lot about this. He was excited that you were coming on to talk about this today.
Well, I know a lot about the California system and how they, and like you were saying, how they get it down to a science with using the indica and sativa and planning out the the aspects that the medicinal marijuana can